Okay, so today's lesson is called Curing the Healthcare System. And one question is, how should medical coverage for the uninsured be funded? The purpose of the Affordable Care Act was to ensure that all Americans had access to health coverage. The intention was to create a single-payer universal health care system. That's how it was originally proposed. Yet, because of partisan divisions, when it was finally signed into law, little of what was originally proposed was left. And we will be talking about the Affordable Health Care Act today and what was left of it after it was carved up by partisan division. Yet the question still remains, how should medical coverage for the uninsured be funded? Now first, let's go back a little. The very first president to propose a single-payer national health insurance plan was Harry Truman in 1949. And big surprise, Congress failed to approve it. FDR had mentioned it. Harry Truman actually pursued it. And the next Democratic president, Lyndon Johnson, had some major successes in regards to health insurance, chief of which were Medicare. That is, passed in 1965, covered medical care for people ages 65 or older, as well as Medicaid, which we'll look at more in just a moment. This was considered landmark legislation. At the time, guess what? It was called socialism, because we're providing health coverage for the elderly. Oh dear. And conservatives like to claim that we were moving so far to the left we were jumping in Stalin's lap. But before long, when they figured out that it worked, the very people who were criticizing it were championing it. A little more about Medicare. By the 1960s, Medicare was taking an increasing share of federal spending. In fact, it is one of the largest budget items in the federal budget. Paying for the health insurance of the elderly is a rather significant undertaking. Now, President Bill Clinton proposed a very complex plan to control cost and to eventually provide universal coverage. As I mentioned, every Democratic president, from FDR mentioning it to Harry Truman pursuing it, has been working towards a national health insurance plan. So all this single-payer talk you've been hearing is nothing new. Yet, doctors and private insurers lobbied to stop it. What does that mean? What is a lobby? That means paid professionals whose job it is to send campaign contributions and to intercede personally to lawmakers on behalf of private corporations. So someday if you decide to become a lobbyist, it's a rather lucrative job. It becomes your job to speak to lawmakers on behalf of the group that you represent. And that could be anybody. Cigarette manufacturers have lobbies, marijuana has lobbyists, big tobacco, again, alcohol, oil, any industry that you can think of has lobbyists. And it's their job to represent the industry that they are hired to represent on behalf of the lawmakers. And so in this case, lobbyists representing private insurers and representing doctors interceded and stopped national health care in the 1990s. And meanwhile, there wasn't really enough public support for it because the idea did involve significantly increasing the size of the federal government, and so this was defeated in 1994. So meanwhile, on to health insurance. Many Americans are afraid that, and this is one thing that the Affordable Health Care Act actually abolished, prior to the ACA, also known as Obamacare, you could be denied health coverage if you had a pre-existing condition. That means if you were born with an autoimmune condition, when you went to get health insurance on your own, they had the right to say no. No, you have this pre-existing condition that you had before you applied for health insurance. We don't have to offer you health insurance. Period. And so the Health Insurance Portability and Accountability Act of 1996 required insurers to provide coverage to all new employees who had health insurance before changing jobs. So this still excludes those who do not have health insurance and are seeking to get a first health insurance plan if they have a pre-existing condition. So they still have the right to say no if you're sick before you ask for insurance. Yet, if you are currently employed and you already have a health insurance plan through your employer, that's now made it illegal for insurers to drop you, because they could if you have some type of terminal condition prior to 1996. Meanwhile, the 2000 presidential campaign highlighted the need for prescription drug coverage for the elderly. In fact, many thought this should be a necessary overhaul of the Medicare system altogether. In regards to health care, the 2000 election also highlighted the need to protect patients' rights and the need to expand health coverage to the ranks of the uninsured, because as of the 2000 election, there were tens of millions of people who did not have health insurance, and that means the simplest malady could result in generations worth of debt. A cancer diagnosis could mean hundreds of thousands of dollars of debt for someone without health insurance. Now, a little about Medicare's beginnings. When Medicare began in 1965, the cost of prescription drugs was rather small. The main expense in medical care was hospital stays and visits to the doctor. Yet, one of the reasons for the increasing cost of medication has been the development of new medicines and treatments for heart disease, arthritis, and other chronic conditions. These drugs have become the fastest component of healthcare spending because chronic conditions mean dependency on these drugs for your survival. If you have a chronic health condition, that means you have to take these medications, which may be the only thing keeping you alive. And for many people, they have to take these expensive medications or they will die. So there's no choice. And with such demand on these products, we call that inelastic demand, meaning that it will not change because people have to have these things to live. Therefore, they will pay whatever is necessary. Then the price of drugs can go up simply because of the market demand for them. But also the cost to develop these drugs. You see, to get a drug approved by the FDA often requires 10 to 20 years worth of research, double-blind studies and clinical trials on first animals and then humans that have to demonstrate a statistically significant effect that outweighs the side effects. In order to prove the effectiveness of a drug to get it approved by the FDA, a great cost must be undertaken. And so yet another reason for the increase in healthcare spending. Now, almost half of people on Medicare don't have prescription drug coverages. Now, for the elderly, those are often the folks that rely on prescription medications the most. If my grandmother didn't take arthritis medication, she would be unable to get out of her bed because of the terrible pain associated with arthritis. My other grandmother has to take pain medications for her back. She would be hospitalized if it weren't for those medications. Yet she has to take those. Both grandmothers have to take those every day, and I'm sure you can relate and have family members that are going through the same situations. And yet, in the beginning of Medicare, these medications would not have been covered. And so what we would have found was many of these people could not access these medications that preserved their lives. So many elderly citizens were having to pay $1,000 a year out of pocket for medicine or do without. Now, $1,000 a year is very significant, especially for the elderly who are usually unable to work. Now again, back to the election, because this is a very political issue. In the 2000 election, the Democratic Party proposed a drug benefit through Medicare. The Republican Party wanted to give seniors the option to choose their own insurance plans, which would be subsidized by the federal government, meaning that these plans would be partially covered through the federal government. And the big difference was that the Democrats wanted Medicare to provide all the cost of medication. And so the controversy here that this election highlighted is, should drug benefits be tackled on their own, or should Medicare be reformed first? Now, when your article was published in 2003, the concern was that Medicare would begin to start running out of money by 2010 and would be entirely bankrupt by 2025. And the main reasons for this are the rising costs of medicine and health care and the changing demographics, meaning like the Aging of America lesson that we went over, how there are becoming increasingly more elderly people in our country than there are younger people. And so that means there are more people needing to receive benefits from Medicare than there are paying into the system. And that's a concern and has led many to believe that Medicare will not be sustainable. Because, as I said, with the aging of America, Americans are living longer than they were in 1965. In fact, in 65, the average age was 65, which is why benefits began at 65 to cover you in your final years. And yet now we live, on average, well into our 70s, often into our 80s and 90s. With clean living and a healthy diet and exercise and access to health care, we can expect to live a long, healthy, and happy life. And so because, heck, I plan on making it to 100. By gosh, I'm going to get there. Because we plan on living so long, and because, well, I plan on retiring from this job in my mid-50s. My pension will kick in at that time, and guys, I'm out. I'll begin my new job. I'll work somewhere else part-time or do something fun. I'll go sit on the river and watch the rafts come in. I don't know. I'll do something fun. Moving on from my real job. Like many people, will begin to retire earlier and live longer. And people like that, retiring earlier and living longer, are going to make up a greater percentage of the population by the time I get there. And with more elderly people driving up the cost of Medicare, because elderly are going to continue to need more medications, I'm hoping that by the time I get older, there will be an Alzheimer's medication, because that does run in my family. So I'm hoping before all of my brain leaks out my ears, there'll be something to stop the leak. Well, with the rising cost of medicine and the shrinking number of young people that are working, contributing to the system, the concerns are that Medicare will not be sustainable. Because here's where we are right now. It takes 4 workers to pay for one person on Medicare. So that means that when you grow up and get your real job and you're thinking about, little Granny Mosblick who's going to start needing some help and her Medicare's kicking in and it's going to take 4 of you to pay for her to get those treatments that she so badly needs. And projections are that in 2035 there will only be 2 people available to pay for little Granny Mosblick. And that's sad. And that's rather scary. Because really it takes 4 people paying into the system to support one elderly person on Medicare. And yet with changing demographics, we're not even going to be halfway there. So the question is, what are we going to do? So you see, the projection is that taxes are going to go up to pay for this, to offset the cost, especially if health care costs continue to rise. So what do we do? And I have to admit, this is one of the toughest questions looming in this election. Because you see, there are vastly different plans proposed on either side. And don't get me wrong, this is one of the more important issues in the campaign. It really is, of what is to be done. Some countries have already gone single payer. They've shown decades of success under that plan. The United States currently has one of the most expensive healthcare systems in the world, if not the most expensive. And so is there anything that can be done, or do we have to resign ourselves to ever-increasing tax rates to pay for these changing demographics? Some policies proposed have been to place more restrictions on Medicare benefits. One side of the aisle, I'll leave you to figure out, has proposed that we raise the age of those eligible for those benefits, or increasing the share to be paid by the elderly. So by saying, for example, instead of being responsible for $1,000 a year for your medication, doubling that figure. Or instead of being eligible for these benefits at 65, having to wait until 75. And these are things that will affect you when you get there. And I know it feels like a lifetime away. But these things will certainly affect you. And then again, another of the policies proposed has been to move to a single-payer health system. For example, a buddy of mine got badly injured in France. He had to get x-rays. He had to be put in a cast. He had to stay the night in a hospital. He recently received the bill via mail. $100. Now, okay, socialism. Yeah, France is a socialist country. His bill was $100. Call it what you will. His leg was fixed. $100. All right, let me quote Michael Tanner from the Cato Institute, and I quote, "Premiums already represent a significant burden for many elderly Americans. Any major increase risks pushing many of the elderly into poverty." Premiums there mean the overhead or the payments that you have to pay to go to the doctor. For example, I have health insurance. It's called an 80-20 plan. That means that 80% of my costs are covered through Blue Cross Blue Shield that's provided here as part of my job. Getting health insurance was a big motivator in going to get a real job and having to do grown-up things. Working in the raft company was super fun. I could have done it for my life, but I didn't want to because I needed the benefits of health insurance, because if things happen, I have to be able to insure for that. Because you see, I've been injured without health insurance. Hopefully that never happens to you guys. It is a scary thing to be hurt without health insurance. I lived with a torn ACL for 2 years because I didn't have health insurance. I felt like an old man in my mid-20s, having to limp around because I couldn't afford to get it fixed. And as soon as I moved to North Carolina and began teaching, and I got health insurance, very first thing I did was scheduled a meeting with an orthopedic surgeon. and I had health insurance. And guys, without that, I would still be limping around today. And yet, because of that surgery, I was able to coach cross country for 5 years. And I'm able to live an active lifestyle today. Without that surgery, I might be walking with a cane. Kid you not, my early 30s, I'd be walking with a cane. Guys, that's real. That's scary. And that's what motivated me, really, to get a good job. And that's great for my situation with no kids, that I had the opportunity to pursue an education and move on to get a real job. But that becomes increasingly difficult if you have children. And if you don't have the ability to go get that education, because it's cost prohibitive, because we have one of the more expensive higher education systems in our country. But I digress. So the concern is that if we raise premiums for the elderly, we risk putting a financial strain on those who are unable to pay for it. And yet, back to the 2000 election. Another issue was a bill that would make it easier for privately insured Americans to resolve disputes with their health maintenance organizations known as HMOs or other insurance providers. The Patient Protection Act would allow the insured to seek emergency care without receiving prior approval and to visit pediatricians, gynecologists, and other specialists more freely. For example, thanks to the Patient Protection Act, I knew it was a waste of time to go see a primary care provider about my knee. I knew all they could really do was feel around on my knee and realize that it hurt and prescribe me some pain meds. And that's about all they could do. So I knew that I'd already read enough online to bypass that step. That was both expensive and unnecessary. And so I went straight to an orthopedist. And he recommended several non-surgical options that I had already educated myself about. I understood that surgery was what needed to happen. And so thanks to the Patient Protection Act, as an insured individual, I was able to go straight to that step, advocate for myself, recommend surgery, get surgery, and be standing here today. It also granted patients the rights to have denial of care reviewed by outside medical experts. For example, I knew I needed surgery. I knew I needed orthoscopic surgery, in fact. I knew I needed a non-invasive type of procedure that could go in and remove the damaged scar tissue on my knee. You actually can't see a scar. It's kind of cool. Like there's no visible imprint left. It was great. It was over in 30 minutes, and I was walking. Had he refused to give that care, I have the right to a second opinion. For example, my mom has osteoarthritis. She struggles to walk, and she's in her early 60s. Right now, she should be like doing all kinds of stuff. She should be able to run. She should be able to ride bikes and swim, which she loves to do. But she struggles with these things, these simple acts of daily life. And she shouldn't have to. Well, a doctor recently gave her the option of getting her knee replaced, which is probably what needs to happen. But she was able to get a second opinion from her brother-in-law, who is an orthopedist, and he was able to give his expert advice as well. And the doctor was required to share the results with next. More on this issue. Because of this law, patients who were not satisfied with the outcome of their review would have the right to take their health insurance providers to court. Thankfully, I've never had to experience this, but many people have. For example, if you have insurance, but your provider tries to claim that a certain procedure that you need is not part of their coverage, you have the right to take them to court. Now, President George W. Bush opposed the last part of this bill. He said they wanted to put a cap on damages and restrict suits to federal courts, which he argued would simply be too costly. Now next, in the year 2000, there were millions of Americans that were uninsured, roughly 15.5% of the population. Now, when I updated this information, as of September 24th, 2014, 15% of Americans were still uninsured. Now, roughly 11 million of those uninsured in our country are children. And this despite the Children's Health Insurance Program in 1997. The idea for this was to provide funding for states so they could offer health insurance coverage to children of low-income people who earn too much to qualify for Medicaid. So, for example, if you qualify for Medicaid, that means your family makes below a certain amount, and that provides you with free health coverage. Now, if your family makes just above that minimum amount, you do not qualify for Medicaid. In fact, you don't qualify for any type of subsidized health insurance. Yet, the Affordable Care Act, I need to correct that statement, can provide you subsidized health insurance. Meaning the idea is that lower cost insurance for those who make just above the minimum for Medicaid. And so through the health market exchange, the federal government will help you to find the lowest cost health insurance possible.
Good morning, Hank. It's Tuesday.
Good morning, Hank. It's Tuesday. I want to talk today about why healthcare costs in the United States are so phenomenally, fascinatingly expensive, but first I have to blow your mind. Alright, so you've probably heard that the reason people enjoy quote-unquote free healthcare in Australia and the UK and Canada, etc., is that they pay higher taxes. That money then goes into a big pot and is used to pay for people's healthcare. But in fact, in the United States, we spend more tax money per capita on healthcare than Germany, Australia, the United Kingdom, or Canada. That's right, Hank. You pay more in taxes for healthcare than you would if you were British, and in exchange for those taxes, you get no healthcare. In fact, only about 28% of Americans get their health insurance through government-funded programs, mostly poor people, old people, and congresspeople. But as you can see in this graph, our private healthcare spending, most Americans are privately insured through their employers, is way higher than anywhere else in the world. In total, the U.S. currently spends about 18% of its gross domestic product on healthcare costs. Australia, by comparison, 9%. Why is this? Well, because everything costs more, which seems obvious, but apparently it isn't, because every article you read is like, oh, it's because of malpractice insurance, or it's because we're obese, or we go to the doctor too much, or people are prescribed too many medications. Well, not really. It's because everything costs more. A hip replacement in Belgium costs $13,000. In the US, it's often over $100,000. Colonoscopies average over $1,100 a piece in the US. In Switzerland, they're $655. And on average, a month of the drug Lipitor will cost you $124 if you live in the United States. If you live in New Zealand, $7. Now, we are also, not to brag, richer than all of these countries, so it makes sense that we should spend a little more on healthcare. But we don't spend a little more. We spend a ton more. And vitally, we don't get anything for that money, which means we are essentially paying people to dig holes and then fill those holes back up. Like, we don't live longer, in fact we're 33rd in life expectancy, and in everything from asthma to cancer, according to one recent nonpartisan study, American health outcomes are not notably superior. So why are we spending all of this money for nothing? Well, first, let's discuss some of the problems that are not actually problems. For instance, the problem is not so-called overutilization, the idea that Americans go to the doctor more and get more tests and spend more time in hospitals. We know this because Americans actually go to the doctor less than Europeans and spend much less time in hospitals, although to be fair, you can stay in a Dutch hospital for 7 nights for what it costs to stay in an American one for 1 night, so no wonder we're hesitant. Also, it is not because we are sicker than other people. Everybody likes to blame obesity on our...
Now, by the end of the year 2000, more than 3 million children had benefited from this program, and a federal initiative was in place to reach millions more. Yet, as John Green is going to tell you, you're going to notice that our costs are exceedingly more expensive than other countries. In fact, it's often cheaper to fly to some of these other countries to get procedures done and to stay in those countries while you're having those procedures done than it is to have them done in the United States.
Rising
healthcare costs, but yeah, no. That argument is just not supported by data. For one thing, disease prevalence does not affect healthcare costs that much. And for another thing, while we do have more obesity in the United States, which sometimes leads to health problems, we have fewer smokers and less alcohol consumption. Really? Apparently, yes. So that saves us a little money, and if you compare us to, like, the British or the French, in the end, it's probably a wash. Hank, the truth, as usual, is complex. Like, there are obvious inefficiencies in our healthcare system. For instance, not everyone has insurance. If you don't have insurance, you still get healthcare, but you are responsible for paying for that healthcare, which often you can't do, so you end up going bankrupt. That sucks for you, obviously, because you're bankrupt, but it also sucks for the rest of us, because we have to pay not only for your care, but also for all the money the hospital spent trying to get you to pay for your care. Also, the only options available to uninsured people are usually the most expensive options, like emergency rooms, which is just bananas. But those inefficiencies are hard to measure. Fortunately, there are things that we can measure. So like I said before, because the US is one of the richest countries in the world, you would expect us to pay a little more for healthcare than most people. The question is, when do we pay more than you would expect us to pay? And that turns out to be pretty interesting. Let's start with malpractice and so-called defensive medicine. The idea here is that doctors are scared of huge malpractice suits, so they order a lot of unnecessary tests in order to, like, cover their butts. That does contribute to our healthcare costs, like there are more MRIs and CT scans in the US than anywhere else. However, there are a bunch of states, like Texas, that have passed tort reform to limit malpractice suits, and in those states, healthcare costs have dropped by an average of a whopping 0.1%. The biggest estimates for the total cost of defensive medicine put it around $55 billion, which is a lot of money, but it's only 2% of our total healthcare costs. Another smallish factor, doctors, and to a lesser extent nurses, are paid more in the United States than they are in other countries. And by my possibly faulty math, we end up spending about $75 billion more than you would expect us to there. Then we have the cost of insurance and administrative costs like paperwork and marketing and negotiating prices, all that stuff. That's about $90 billion more than you would expect us to spend. We spend about $100 billion more than you would expect on drugs, not so much because we take more of them, but because the ones that we take cost more per pill. Okay, and now for the big one. I'm gonna lump inpatient and outpatient care together, because in the US we do a lot of things as outpatient procedures, like gallbladder surgeries, that are often inpatient procedures in other hospitals, so we're just gonna make it a big ball. That big ball is $500 billion more than what you would expect given the size of our economy per year. Why? Well, because in the United States we do not know.
Now, I do think he's doing an excellent job of breaking these things down. Bottom line, healthcare in America is far more expensive than it is in other countries. And there's a rather universal agreement that something needs to be done about this, yet the methods proposed are vastly different. The Affordable Health Care Act, also known as Obamacare, called the devil by so many, the purpose of this was to increase the quality, accessibility, and affordability of health insurance. In fact, it was a step towards a single-payer system, a national insurance plan. And yet it was butchered by Congress, and now we have what we have. One of the provisions of the Health Care Act, in fact, perhaps one of the most controversial, was that people who can afford to must obtain health coverage by 2014 or pay a fee. And so this requires Americans to purchase health care coverage because American hospitals and doctors do not have the right to deny coverage to anyone. And what this was seeking to overcome and to prevent is people who cannot provide health care. That burden is placed on the taxpayers. So if a homeless person, and I've seen this happen, I was waiting for friends outside of Adelphia Stadium in Nashville. We were going out to dinner, and two homeless people approached me and asked for money. I couldn't help them, but we sat and talked for a while. While we were talking, one of them began to convulse and shake, actually began to lay on the ground and seize. Vomiting out of his mouth. It was pretty scary. I'd never seen that. Didn't know what was happening. His buddy said, "Oh, he's just DTing, mean detoxing from alcohol, or drugs, or who knows." It's still a scary situation. You can die from that. So I called 911. Called 911. Paramedics were irritated because they knew this was a homeless man. They knew that no one could pay for him, yet still they cannot deny care. So the ambulance was there swiftly, probably saved the man's life, who knows. Got him an IV, pumped some fluids into him, and for most situations he was probably fine once he got an IV and got some food in him. But you never know, because if that DT was coming from some type of drug shock, and if it was more severe than alcohol, even alcohol can kill you. It's signs of an overdose when you convulse like that and begin to seize. And so, anyway, they may have saved his life. Well, I'm sure he didn't have health insurance. And I'm sure he couldn't afford the emergency room visit and the ambulance care that the paramedics provided. Yet still, that didn't stop me from calling 911. I'm not just going to say, dude, you can't pay for this. Sorry, can't help you. Have a nice day, as he dies, in front of me. You would do the same. In fact, doctors would do the same. That's not going to stop anybody from treating someone who is in serious need. And yet, if people can't pay for it, well, then the costs do go on to the taxpayer. So that was the idea by requiring people to get health insurance. Also, the Affordable Health Care Act eliminates pre-existing conditions, meaning that no health insurance provider has the right to say, no, you can't have health insurance because of a pre-existing condition. And then finally, it stops health insurance companies from dropping you when you were sick. Yes, this would often happen. Let's say something unfortunate happens in your life. You become ill. You find that you're sick a lot. In fact, you spend an entire year being sick and being not sick and being sick and being not sick. This happened to my wife a few years ago. She spent a year off the couch, on the couch, sick, not sick, went to various doctors. It was rather scary. This whole year we were wondering, does she have autoimmune? I mean, does she have lupus? Does she have scleroderma? Does she have something that is going to last her throughout her life? Doctors really had no clue what was going on. This is a scary situation to be in. And finally, we went to a specialist. Now, you see, thanks to ACA, Blue Cross Blue Shield had no right to drop her during this time that she was sick, because they were having to pay an increasing share for her. And you see, Lucas, they didn't have the right to drop her from coverage, even though they were having to pay more for her than they were for me, who I never went to see the doctor that year. And anyway, they found out it was just allergies. Such a simple thing. They did a very simple procedure, took a couple hours. She's good. She gets allergy shots now. She takes a daily pill. She's fine. And it's neat how, like something so scary, we could rest assured that at least we would be provided for through our health insurance. And then finally, it protects against gender discrimination, because sometimes health insurance companies would charge more for women than for men. Why? Well, because women need often more expensive care, or for the possibility of pregnancy. And so it does
negotiate as aggressively as other countries do with healthcare providers and drug manufacturers and medical device makers. So like in the UK, the government goes out to all the people who make artificial hips and says one of you is going to get to make a crap ton of fake hips for everybody who is covered by the NHS here in the United Kingdom. But you better make sure your fake hips are safe, and you better make sure that they're cheap, because otherwise we're going to give our business to a different company. And then all the fake hip companies are motivated to offer really low prices because it's a huge contract. Like, think if your company got to put hips inside of everyone in England and Scotland and Wales and Northern Ireland. I guess not everyone, just the people who need hips. But in the US, we don't have any of that centralized negotiation, so we don't have as much leverage. The only big exception is Medicare, the government-funded healthcare for old people, which, not coincidentally, always gets the lowest prices. So basically, Hank, in the United States, providers charge whatever they think they can get away with, and they can get away with a lot because it's really difficult to put a price on, like, not dying. This is a phenomenon called inelastic demand. Like, if you tell me that this drug that will save my life costs $7 a month, I will pay you $7 a month for it. If you tell me that it costs $124 a month, I will find a way to find $124 a month to pay for it. You can't negotiate effectively on your own behalf for healthcare services because you need them, and not like you need a new MacBook Air or the new season of Sherlock, but actual physical need. I guess it is like the new season of Sherlock. So basically, Hank, until until and unless we can negotiate as effectively with the people providing healthcare as Australians and British people do, U.S. healthcare costs will continue to rise faster than anywhere else in the world, and we won't get better healthcare outcomes. Hank, I know this video is long, although it could have been much longer, but I am so tired of people offering up simple explanations for what's wrong with our healthcare system. They say, oh, it's malpractice, or it's doctors who must also be business people, or it's insurance companies, or it's insane rules for who can get insurance. It's drug companies, it's government bureaucracy, it's an inability to negotiate prices. Yes, 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 and yes, it is all of those things and more. It is not a simple problem, there will not be a simple solution, but it is probably the biggest single drag on the American economy, and it's vital that we grapple with it meaningfully instead of just treating healthcare costs as political theater. So I hope I've at least introduced the complexity of the problem. I've put some thoroughly nonpartisan links in the doobly-doo for further reading. Hank, welcome back to the United States. As you can see, everything is peachy here. I'll see you on Friday. Friendly reminder, educational videos are allowed to be more than 4 minutes long. All the people who are commenting about how punished I am did not watch to the end of the video. I feel dizzy.
Okay, now a little more about the Affordable Health Care Act. This expands free preventative services and health benefits. For example, contraceptives are now free for young people under the Affordable Health Care Act. You've already had sex ed, I'm not going to make you sit through that. Just FYI for your information. And guess what? Teen pregnancy is down since the passage of the Affordable Health Care Act. Ding, ding, ding. Also, it does expand Medicaid and CHIP, which are health insurance programs for lower-income Americans. It does improve Medicare. It does require larger employers to insure their employees, yet we know how often large corporations like to pay their workers very little. So when you go to those McDonald's jobs and they're going to make sure that you're not working the full-time hours, so they don't have to provide you with health care coverage. So they only have to provide health care coverage for those working over a certain amount of time. So sorry, that means that you're going to have to work under that amount because they don't want to have to pay for you. Also, it created a marketplace for subsidized insurance. The idea behind ACA or Obamacare was that it was to ensure that gap of Americans that make too much money for Medicaid and too little to have insurance through their employers. That represents over 10 million Americans, roughly 15.5% of our population. And so ACA was targeted at getting those people insurance. Unfortunately, because it was stripped down in Congress, many of those provisions were negotiated away to get the big part passed. But this marketplace was to provide subsidized insurance for individuals, families, and small businesses with free or low-cost health insurance. And the idea was to decrease healthcare spending as well as the federal deficit because, like you've heard John Green say over and over and over, this is one of the biggest drags on our economy, period. And I'll just leave you with this.